we've got, I'm not going to list all of the individual participants, but we've got participants from the NHS Right Care Delivery Team, from Strategic Clinical Networks, we've got heads of strategy and commissioning from CCGs throughout England, and we've got specialists in public health improvement. So we've got a fantastic group here to discuss some very interesting findings and ideas how we can improve management of cholesterol and cardiovascular disease. So I think at this moment, I think we're probably ready to have an introduction to Heart UK from Jules Payne. So if Jules is on the line, I can hand over to Jules.
Yeah, thanks very much, Dermot. Good afternoon, everybody. I'm Jules Payne. I'm the Chief Executive of Heart UK, the cholesterol charity. So for those that don't know about us, we provide expert support, education and influence to people with raised cholesterol, their families, healthcare professionals, treating those people as well. We're all about preventing premature deaths and suffering from high cholesterol. And HEART is actually an acronym. It stands for Hyperlipidemia, Education and Atherosclerosis Research Trust. Basically, that means that we are experts in all lipids, so not just cholesterol, and we cover both the inherited and the non-inherited forms of lipids. So hopefully that's given you a bit of a potted background of what we do.
So thanks Jules for that. So what we're going to do within the webinar is we're going to have two presentations, and those presentations will give us an idea as to what is happening on the ground and how local areas are treating cholesterol management as a way of preventing cardiovascular disease. Sharing best practice which demonstrates long-term benefits of prevention of cardiovascular disease by implementing strategies, and to identify the gaps which are preventing local areas from prioritising cholesterol management, and to see indeed how Heart UK can support the uptake of cholesterol management across local areas at a time when clearly primary care staff, in particular secondary care staff as well, of course, are under tremendous pressure of resources. So our two speakers today are Martin Cassidy and Dr. Youssef Biani. And Martin is going to go first. Martin has done some fantastic work in the East Midlands, producing tools to help local CCGs and health and well-being boards to understand data on cardiovascular disease in their local area. Martin is the network Senior Quality Improvement Manager at East Midlands Clinical Network for cardiovascular disease, and his presentation will provide an overview of how data visualization techniques have been used to prevent information on cardiovascular disease in a powerful but simplified way, and one which has been most effective in creating a compelling case, I think, for change for commissioning groups, and has helped CCGs identify those priorities. And this presentation, I think Martin will also provide a summary of why we should use these visualization techniques to do a more effective and informative presentation. So I'd be happy for Martin to take that away. But our second presenter, very briefly, is going to be Youssef, is from Bradford's Healthy Hearts, and he's going to describe the award-winning program that they've been very successful in pushing forward with implementation of cholesterol-lowering treatment strategies with the goal of reducing cardiovascular disease by 10% by 2020, which is certainly a very challenging target. Dr. Biani will pick up after Martin's presentation. Then after the two presentations, we will have a general discussion. But during the presentations, I would certainly encourage everybody to continue to submit any questions that they have as they go along, and we can include those in the discussion. So I think it's time to hand over to Martin. Is that correct?